Okay, so I'm Jon Broyles. I'm the Deputy Executive.
It's still hard to get it loud.
I'm Jon Broyles. Can you hear me?
You can hold it in your hand.
I'm the Deputy Executive Director at the Coalition to Transform Advanced Care, which is CTAC. We're a nonprofit based in Washington, D.C. And while we are officially an organization, it's more accurate to characterize us as a movement. And I know that CTAC is a strange name for a movement, but we are a group of individuals united by our personal stories and our personal experiences, combined with our professional skills, coming together to, as we see it, to close the gap in America between what patients and families want and often expect at this phase of life, and what they get, and what people want, and we all have stories that and experiences that reflect and inform our own opinion about this. But what people often want boils down to they want to be at home during this phase of life. They're often the sick person is often living with multiple illnesses, diabetes, heart disease, cancer, so on. And they want to be surrounded by their family and friends. But unfortunately, oftentimes the health system is not there to enable that. There's often no one to call after 5 o'clock on a weekday. And so as a result, the only place to go is the emergency room. And that's often the last place that grandma or mom, who's frail, elderly, wants to go. So that's number one. Number two is folks want their spiritual needs met and attended to. And they want their pain managed. And oftentimes those two go hand in hand, psychosocial needs and physical needs. Number three is that they often want their finances managed. And this has always surprised me when you look at the research, and again, this is borne out in many of our own experiences, is that the number one reason for bankruptcy for medical expenses is trying to pay for advanced illness care in America. And when you look at the research, this is actually the number one concern that most people have as they look ahead in life, approaching this phase. And then, so when you look at what the challenges are, one group is not going to solve this. This is not going to be a collection of physicians coming together or nurses saying, this is what we need to do to change. This is how we need to reorganize. This is how we need to improve our training. That's not going to solve the problem. That might solve a sliver of the problem. What you really need is an alliance. And this gets back to the movement. You need clergy. You need community leaders. You do need clinicians, and you need policymakers. And we're working on the policymaker issue. So based in Washington, D.C., where even mortality, well, it's something we all share, can become a partisan issue. So we're working on that. But I think that today, what we hope for is that our discussion will be centered around what's working. We all have experiences, good and bad, with the healthcare system and lack thereof in America. But the folks that we've brought together with the help of Sarah and Ellen and the Interfaith Center and our partners here are experts in each one of the areas that I mentioned. So they're here to help share best practices, what's working in other parts of the country, and resources, tools that you can take away from the conference today with. And as CTAC, our role is as a facilitator. So we're not here to say that this is the way it is or this is not the way it is. our role is to connect the dots. So we are working all across the country in different regions and pulling together faith communities, community leaders, with leaders from the healthcare side. So pulling together the two halves of the equation. So that the hospitals and the community meeting and working out partnerships. And one place where this is active and up and running is Oakland, California. And Reverend Tyrone Pitts is here, and he's going to talk more about that model and how it's coming together, and some potential lessons learned that could be applied in partnership with you all. So that for me is the agenda for today. Is that you'll walk away with some real practical tools and resources, and also inspiration to know that you have a very significant role in transforming care for the folks that are part of your community. And also to invite you all to participate in CTAC, in the movement. So the way we're organized is by work groups. So we are a big coalition. We have about 120 organizations, from consumer groups like AARP, American Cancer Society, through to health systems. The Interfaith Center is a member. And we are organized by working groups to address each of the issues that we'll discuss today. And so I would invite you to participate, to join a work group within CTAC. And we have a meeting that we call a national summit in March. And that's going to be in Washington, D.C. at the Institute of Medicine. So that's March 2 and 3. And I'd be happy to get you more information if you'd like to find out more. So thank you for coming today. Thank you, the Interfaith Center, for hosting us and pulling this together. And Sarah, back over to you.